All right. Well, I am very, very happy to welcome my good friend, John Michael Lander, and his lovely guest today, Lori Klens. And we are going to talk about, well, I'm not, I'm going to listen to the experts talk about the benefits of ketamine for folks who have, treatment resistant depression, anxiety, or PTSD related to anything, but including the trauma of sexual abuse. And before we get started, since I know that sometimes there are, mixed feelings about things like ketamine, I just want to emphasize that Zero Abuse Project is not endorsing the use of ketamine, but we do support, discussion about any, therapeutic methods or treatments that could be helpful to survivors of trauma, and of course to consult with your doctor or mental health professionals for what's best for you. So with that, I am very excited about today's conversation. I will turn it over to John Michael and Lori. Welcome to you both.
Thank
Thank
you.
you so much. I'm so excited because this is a discussion I've never heard about or anyone taking the time to talk about it. So, Lori, thank you so much for coming and sharing with us and educating us about ketamine and how it can help survivors and everyone actually, as I've learned from you. So, let's do a quick, just introduce yourself and how ketamine, how I should say, New Life Ketamine Clinic came to existence, your mission maybe, and what your future plans are.
Okay, thank you. First of all, thank you for having me on. I'm thrilled to be able to share this wonderful treatment with so many people. I think that's the biggest thing for me is that so many people don't know about it. So, New Life Ketamine, we opened in 2020, in October of 2020. My husband, who has since passed away, he
Sorry.
learned about ketamine in 2018 when he was actually managing some addiction clinics. And one of his patients had gone and gotten IV ketamine treatments and had to go to Chicago to get it. And so, my husband came home and we just started doing some research. And both of us have a passion for people with mental health and trying to find ways to help them. We both have family members with some mental health issues and have a history of working with psychiatrists. So we said, well, let's figure out how to make this more accessible for patients in this area. So we found an anesthesiologist that was very in favor of trying to, be able to help people, deal with their treatment-resistant depression, PTSD. So we were able to open. It took us a long time to open, just because of them being so busy with all of the medical marijuana. So it's about 2 years before we could actually open the clinic. But since that time, we've helped about 400 people get their life back, right? And we hear on a daily basis, like I feel like the name of the clinic is pretty good because New Life, people say I feel like I got my life back. So we definitely are feeling like blessed that we're able to give people their life back. So
That is so wonderful. And you are changing lives. But I just want to throw in there the fact that I think everyone, every human has moments of mental questioning of where
mhm.
their mindset is at times. And this is something that could be for everyone. And I just think it's also that survivors need to understand that they shouldn't be ashamed for needing help or assistance in some way. And by
Exactly.
asking is a way to help yourself. And with that said, ketamine has had been identified as a negative ideation.
Mhm.
There are the people who are not educated about it, just think it's the club drug or the special K or whatever it is, that stigma. And
Or
or
horse
street,
tranquilizer, right? Horse
yes,
tranquilizer.
or the horse tranquilizer, exactly.
Yeah.
How do you go about trying to transform those ideas that people have so that this can be a safe idea? And then we'll get later on, we'll talk about how you go in and, like a day in the app, I can speak, listen to me. As if I came into the clinic, what would I go through? We'll talk about that in a little bit. But how do you help people understand that this is not what everybody keeps saying it is?
Right. So first of all, ketamine has been used on humans. Yes, it was initially created and used in animals, right? But we're all mammals. Many drugs are used in both animals and humans, right? So, it's not uncommon, but since the late 1960s, ketamine has been used in humans for surgical situations in an ER setting. So it's actually one of the safest drugs. If you ask an anesthesiologist, ketamine is one of the safest anesthesia medicines out there because it doesn't cause respiratory suppression. And that's how we're able to use it in an outpatient setting, because it's not causing respiratory suppression like propofol and most of the other anesthesia medicines. So anyway, as far as it being a club drug, yes, it was used, and it still is sometimes used, unfortunately. People are gonna do what they're going to do, right? I mean, we can't stop that. But the nice thing about ketamine is it actually has a relatively low abuse potential. So someone who's using it as a club drug is not getting the benefit of what we're doing in our clinic from it. They you need to dose it very low over a few, and I'll go into that more, but you need to have a lower dose of it for it to work the way we use it in our setting. So most people just inject it if they're using it as a club drug, and they just get a high from it and it wears off in a half an hour, but they're not getting any benefit for their brain. The brain actually is forming new neuroplasticity when used appropriately in the way we use it.
I also just want to keep reiterating that you said that it's in a controlled situation.
Exactly.
It's not like you were abusing it. And I know by coming to visit you at your office how you make sure that everything is recorded, and each person, each client has their own file basically, and what their own program is, because it's different for everyone, right?
Right, it is. So the nice thing about the IV ketamine is, we can tailor it to the patient. It's based on the patient's weight. So, we follow like all the set protocols, safety protocols. I mean, we have a very controlled environment. We have people hooked up to, blood pressure. We're checking their heart rate, their blood pressure, and their oxygen. So we're recording all of that. We're monitoring them. We aren't physically in the room with them, but we are monitoring them by video the entire time. Everyone has a button. It's a very safe environment. We are not running like 5 and 6 infusions. We run no more than 2, and they are staggered at a time. We take the utmost care in making sure that our patient's safety is the number one priority in our clinic. So.
And with that said, I've had the opportunity to come into your office and look at it. It is beautiful, and your staff is so hands-on and caring and empathetic, and they just want the best for everybody. It seems like when you walk in, this incredible warmth feeling as you walk in. And I also had the chance to speak to some of the clients that were waiting to come in and get their transfusion, and they were also very positive about their experience and what it was helping, how it was helping them. And so, what would be like if I came in to get a transfusion, or just walk me through an idea of what I would expect?
Yeah, so I mean, you'll come in and you'll be greeted by our warm, welcoming receptionist. So that is one of the things that was very important to my husband and me, was that we didn't have a sterile environment that people feel like they're in a medical clinic, right? We want people to feel comfortable. We want people to relax. We don't want people coming in with anxiety. So, you come in, you get put into a room with a reclining chair. We can dim the lights. Some people want the lights on a little bit. We have various levels of lighting in the room. But for the most part, most people just have like one of those rock salt lamps or whatever on during their actual infusion. So you're in a reclining chair, very comfortable. We tell people to bring, dress comfortably, bring a blanket if you want. We have some in there, but and then we also suggest that they download certain playlists. There are some playlists that really go well with the ketamine infusions. So EMDR, I'm not sure if you're familiar with EMDR therapy, but there are some EMDR playlists, and there have been some studies suggesting that it actually is beneficial in conjunction with having a ketamine infusion. So we do recommend that. And I've had the infusion with the EMDR playlist, and it's wonderful. It really is. So do I know if it made a difference over me just listening to calming music? I don't know, but I'm going with it because that's what they said. So anyway, so we do want people to bring their headphones, just relax in the chair. And basically, we're going to put an IV in their arm. They're going to lay there for 40 minutes while they have their infusion, and then for about 15 to 20 minutes afterwards until they come down. The nice thing about IV ketamine is you pretty much have liftoff pretty quickly, right? And when I say liftoff, people feel like they're floating outside of their body. That's how we know, like when you just, that's called a dissociative experience. So that's how we know that we're getting people to the right dose. So some people don't dissociate on their first one, so we'll increase the dose the next time. But just because someone doesn't dissociate does not mean it's not working. It's still forming new neuroplasticity in your brain. It's just we may need to get you to a little bit of higher dose for dissociation. And there have been some patients that didn't dissociate at all because they just don't, but the ketamine worked for them. So, and I will tell you that 90% of our patients have responded to this treatment. There's no oral medicine on the market that comes even close to 90% response. All the clinical trials were done. So we do a series of 6 infusions in our clinic. Few people have had to go on and do a few more, but most people are perfectly fine with 6 infusions. So we'll titrate the dose as necessary. But what was I saying? I just had a little brain freeze.
That's great. That's okay. You're just saying how positive it is and how everybody has had
Oh,
a great experience. Go ahead.
yeah. So I remember. So, in the clinical trials for the ketamine, they had like a 60 to 70% response, but they never titrated above the dose of 0.5 milligrams per kilogram, which is what we start at, right? So, our average dose is probably 0.8 milligrams per kilogram in the clinic. More is not always better. Some people want to go up because they feel like more is going to be better, and we caution them against that. And I even experienced it myself when I went through my initial series. I was like more, not because I just felt like it was going to heal me quicker, right? That was what it was. It's not like I felt like I needed more, but I was like, okay. But what I experienced was I had more anxiety by going to the higher dose. So I took it back down for the next one. So, and we have things that we can add in like magnesium to help with anxiety and things, but to be honest, really, you don't need a lot of ketamine to do this. And like I said, more can also have a reverse effect by giving you anxiety.
Great. And I'm glad you brought up the fact of anxiety. As a survivor myself, there is this moment of fear, basically, of giving over to something where I have to just sit back and lay down, and just be there, be in the present. And sometimes I fight that. Is there like petitions on the site that can talk to survivors or people who are having that anxiety before they go into their session, or is that something that is talked about before you even begin? How do you come up with an idea of how much is the right dosage for this person based on their life or what they've come through?
Right. So basically, our practitioners all, have been doing this for a long time. They feel very comfortable. So we just kind of talk them through what was your experience like the last time? How have you been since your last infusion? Um, you know, and then we work with the patient to determine whether they want to go up or not. Now, we are not doing therapy in the office. Most of our patients are already working with a therapist. So we're working toward having like a group therapy situation. But right. And eventually I am going to bring on a nurse practitioner who could also do some therapy. But right now, most people, we either help them find a therapist or they're already working with a therapist. So as far as therapy, we don't necessarily do that in the clinic. And at the dose that we use, so there are people that are doing ketamine assisted therapy. They are using a much lower dose than what we use in the clinic. And while that's good, it takes a longer time for people to see response to that. So we give them kind of the quick fix, and then they can work with their therapist to work on all of that new rewiring that the brain has done, right? The new neuroplasticity. It helps you think differently. Ketamine, like I said, it's forming new neuroplasticity. Basically, if you think about it, rewiring your brain. I mean, that's really what it's doing. Before we thought that depression was a chemical imbalance, but now they're finding that there are many pathways to depression. And before we thought as your brain got older, it couldn't regenerate, but with ketamine, they're actually finding that it is regenerating the brain. So
I think that's really exciting news. I read an article about that where the brain does not stop growing until you actually pass away or transition, however anyone wants to talk about that. And so the fact that this is actually aiding that is something I want everyone to hear, so that you hear that clearly. It's not just a temporary fix, it's something that you need to work with. And like you just said, you encourage them to continue their therapy because I think that's really important. If you're having a therapist and they're working for you, keep going. This is just something that can actually help. And it could be something that you could talk about in your sessions with your therapist. Now, are there any side effects for like survivors should worry about if they come in and take ketamine? What are some things that may happen while they're in there getting
Okay.
the infusion?
Yeah, I mean, ketamine is extremely well tolerated. That's another reason why ketamine is one of the favorite anesthesia medicines. And it actually is the anesthesia of choice for kids because it's so safe and well tolerated. So at the dose that we're using, very few side effects have happened. Some patients will experience nausea. About 30% of our patients experience nausea while they're getting the infusion. But obviously, we have all the medicines there to counteract that. So it's occasionally someone will have an increase in their blood pressure. So we do want to make sure that someone has controlled blood pressure prior to coming in. And if they have a little bit high blood pressure, it's not a problem. But if they do have high blood pressure that's uncontrolled, we want to make sure that they get that taken care of prior to coming into the clinic. And then urinary frequency, it does make you have to feel like you have to go to the bathroom. So we ask people to empty their bladder before they go and they have an infusion. So anyway, and then occasionally someone will have like a headache the next day, but that's rare. I mean, I would say that maybe 3 to 5% of the patients have had a headache. And then the biggest one is the dissociative experience. That a lot of
Right.
people would consider that to be a side effect. But most of the patients, if you ask them, they're like, I thought it was great. So anyway, it feels weird, but you feel like you have this disconnect between your brain and your body. I know that for me, it took me back to beautiful memories of my husband and myself. I obviously had a lot of uncontrolled anxiety after he passed. And so I've been on antidepressants in the past and was just not going to go down that route again because I felt just blah. I felt like non-emotional at all when I was on the antidepressants, right? Like I couldn't have any emotions. And so
Yeah.
I wasn't going to go down that road and all the side effects and weight gain and, well, sexual side effects, but anyway, doesn't matter for me, but it is for a lot of people. And if you're in a relationship and you're dealing with, weight gain, so it makes you feel bad about yourself or the sexual side effects, this ketamine does not cause any of that. So,
That's impressive. That's impressive. I do remember when we were talking in your office, you shared a little bit about how some people have gone back to their traumatic moment while they're in their session, and that there are people there that will be able to help them through that as they get through the whole 45 minutes or however long you said it
right.
was. But that's something I think survivors are really worried about. I think a lot of times survivors go to therapists to get medication so they don't feel. And I think that's something that you had said earlier. And then yet, this is something that you almost, if you feel it and you go through it, you create new neural pathways in your brain. You can get beyond maybe the situation and change the meaning of what that traumatic event was for you. Because I think a lot of times the anxiety that we carry with us is based on what we have attached the meaning to what happened to us. And
Yeah.
sometimes that can keep us in that depression state, that is not being helped. And I think this could help that, correct? Do you think that as well?
Exactly. Oh, absolutely. So when the people have experienced it, say, you've had a traumatic experience and you revisit that when you're in a ketamine infusion, people say it's almost like an emotionally neutral situation. They don't have the fear, they don't have the hurt, they don't have the anxiety. When they face it, it's almost an emotionally neutral situation. And then every time that people have come out of it, they said they felt like 10 pounds has been lifted off their shoulders. And then what happens because of the new neuroplasticity in our brain, we're able to go back to our therapist and work with the therapist and learn how to move forward, right? And deal with the stressors and the triggers. And so they're able to really just not move on completely, but you know, I mean, people are, but I'm just saying like it takes time. So ketamine, I like to tell people ketamine is a part of your journey. It is a tool in your toolbox to help you move past the things that you've experienced. But in and of itself, ketamine isn't going to do it. You do have to put the work in and continue with therapists. It is very important for people to get therapy. And we're not asking people to go back to the psychiatrist and say, I want to get off of all medicines. We have had many patients get off of most or all of their medicines, but we've also had patients come to us on 6 or 7 different psych meds and they get down to 1 or 2. It's more tolerable for them, right? They don't have all the side effects. You think about the compounding of all of these medicines and all the side effects that they experience. And some people are then given medicines to counteract the side effects from the other medicines. And so it's just a vicious cycle. So if we can, you know, rewire the brain to think differently and maybe have, you know, 1 or 2 meds instead of 6 or 7. But we have had many patients get off of their medicines. They're still working with their psychiatrist on a regular basis, but and also getting therapy, right? We're not here to replace psychiatry or therapy. We're here to help people. We're here to work with their mental health providers to help them have a good quality of life. And that's what people have to understand is, you know, yeah, maybe some of the medicines, the oral medicines can actually get people to respond, right? They'll feel a little bit better, but most people feel like no affect whatsoever. I mean, I actually had a patient last summer say, I had no idea the flowers were so bright, like the flowers in the garden. She said, I never saw them as bright before. And after ketamine, I see things in a more beautiful manner, right? Everything becomes more beautiful. Everything becomes brighter. Everything, it's just people can find joy where before they maybe felt like they could survive, but now they can find joy after having ketamine.
That's amazing. And I'm still stuck on one part that you were talking about, the disassociation sometimes. And when you see that if you have another reoccurrence of what happened, of your traumatic moment, you see it in a different light. You see it like almost like when you were talking about that, all I could picture was like I was floating above it now. And I'm looking at it and it's okay, there it is. That's what it was. That's what happened. But I'm emotionally not attached to it again, which is
Exactly.
a freeing thing to me. I mean, to be able to not have that attachment
Yeah.
and that meaning to it and look at it and be able to be, okay, I'm objective about it. That's what it was. Okay, let's go on. And I think that's just crazy beautiful to me.
Yeah,
And also,
it is. It's
go
amazing.
ahead.
Well, I just want to tell you about this one. It was when we first opened back in 2020 or maybe early 2021. And we had a patient who all of a sudden we could tell his blood pressure went up. So, you know, the doctor, it was the anesthesiologist given the infusion at the time, and he runs in there and the patient was like, wow, that was awesome. Like he finally had a breakthrough and it was like at his 5th or 6th infusion. And he did go back to where he had trauma, but he was like, he was excited about it because he said, it's the first time that I thought about that I didn't hurt. I didn't, I didn't
Wow,
feel it. And then he's like, I swear, I feel like I just lost 10 pounds.
fantastic.
Yeah.
And
Yeah.
I know this wasn't what we were thinking about talking about, but it popped up in my mind again about you had a client who had an substance abuse issue. And you have to look at that before you allow them to come into the clinic and take their treatment, correct? Can you
Yeah.
explain just a little bit about that so that people can understand that, oh, we're not just adding something on top of what I'm already doing?
Correct. Yeah, we are. So, you know, one thing that people have to understand is, you know, substance abuse goes hand in hand with mental illness, right?
Mhm.
People are self-medicating through their substance abuse. more often than not, right? So we are very careful. We like psych referrals and therapy referrals. We will let people come as long as they have tried the appropriate measures, without a referral, but we prefer a referral. But we do drug screen everyone, and we compare, so we can get a report of any kind of narcotic that someone has been prescribed. If they have something that shows up in the urine drug screen that does not match what they've been prescribed, we will not treat them until that is clean, right? So they need to make sure, we're not here to create or to give people like a high just to experiment, right?
Right, right.
We're here to help people that have serious treatment resistant depression, mental health issues get better and feel better. So most of our patients have been on anywhere from 5 to 25 different antidepressants in the past, and nothing has worked, or they've never felt great. And they come and they do the infusions and they're like, wow, now I know how I'm supposed to feel. So,
One of the things that really impressed me when I visited you was talking to the clients, the patients outside in the little waiting room, and the divergence of it, not divergence, that's not the word I want to say, but the range of ages. Because I believe young man was an athlete in his early 20s. And then there was a man that walked in who was in like 70s. And then there was a woman that came in and she was about her 30s. And it was just like how it becomes this community of wanting to heal and help ourselves. And this is one of the ways that it has helped. So it's helping everyone across, it's not just a certain group of people. But I do want to talk a little bit about, and you touched on it, but I want to go in a little bit deeper. How is ketamine different from other oral medications? Because I
okay.
think that's something that we need to look at and just get an idea. You don't have to go crazy deep if you don't want to, but just something so that we can understand, the layman person could go, oh, I like this. This sounds something I want to do. I want to find out more information about it.
Right. Okay. So yeah, the oral medicines, they pretty much focus on one pathway, right? So serotonin reuptake inhibitors, right? SSRIs. That's what the most common class. Pretty well tolerated, but still have some side effects to them. But there are all these different antidepressants that work in a different area. So what we found is that there are multiple pathways for depression, right? So ketamine, so those all work on a singular pathway. Ketamine actually is a dirty drug in a good way, right? It manipulates the neurotransmitter called glutamate, and it works in the glutamate system of our brain. 80% of our brain is glutamate responsive, right? So it makes sense that so many more people would respond to ketamine than an SSRI, because there's a smaller percent of our brain that is affected with serotonin, right? So I don't know, it's hard to explain, other than the other thing is that ketamine works very fast. So in the first 6 infusions if you're going to have any benefit from ketamine. I don't want people to stop. We do tell people you need to complete this series of 6, because if they stop at 2 or 3, but they were some of those people that didn't see any response until number 5 or number 6, they've wasted their time and their money, right? So we want people to understand it's a series. It is a process, and you need to trust the process, right? It's kind of like building a house, right? When you build the house, you build the foundation, then you put up the frame, then you put up the walls and do the paint and all the other stuff inside, right? So it's kind of the same thing. So the finishing touches are number 5 and number 6 of your infusions. So ketamine acts very fast versus the oral antidepressants that take 6 to 8 weeks to have any response. And then if you need to go up in the dose, it may take another 3 weeks for it to get more response. Or if you need to change, then you got to start all over. You got to wean off one and start all over. Ketamine's fast, it's easy. It is, like I said, it has to be at least third line. Unfortunately, at this point, because I think the psych community is so used to trying 5, 6, 7, 8, 9 antidepressants, it's way down the list. And I guess what I'd like to see is ketamine being moved up to, okay, we've tried 2 different classes of antidepressants. They didn't work. Let's try ketamine and see if it works. So it would be nice if it were really third line. But I think it's going to take a little bit of time. But the more people know about it and ask their doctor about it, the more likely that's going to happen.
Why do you think the professionals out there are so resistant against ketamine? You know, instead of allowing it to rise up to be the third item in that list, they keep trying to hold it down, it feels like. And how is this affecting big pharma? You know, big
Right.
pharma
So
wants you on that depression drugs because that's where they're making their money, and this is not. So you're really dealing with not just getting the word out there, you know, word by mouth, I guess you would say, but also dealing with the pressure of big pharma coming down.
exactly. So I'll address, first of all, why the psychiatrists are not. I think it's just habit. They're just used to going through so many different medicines. I don't think there's anything against ketamine. The ones that have something against ketamine have not taken the time to learn enough about ketamine. There's no other reason, because if you read this clinical trials and all the information that's out there, I mean, ketamine's been used since 2010 for depression. So, now it didn't become more mainstream until the last like 3 to 4 years, actually really the last 2 years. But yeah, I think it's just habit and lack of knowledge for the psychiatrist. As far as big pharma, yeah, you better believe they're trying to make it so that ketamine is not well known. When poor Matthew Perry, but when Matthew Perry died, right, Big Pharma tried to pick up on that, oh, it was because of ketamine. Well, first of all, he did have an IV ketamine infusion 10 days prior. Ketamine has a half-life of 4 hours. So it was out of his system. Now it continues to work in your brain for 10 days, up to 10 days after you have an infusion, but it wasn't IV ketamine that caused him. He actually somehow got a hold of oral ketamine and took an anesthetic dose. I mean, we're talking about someone he was a substance abuser, right? So that's why you have to be so careful, and why we do not allow anybody, we don't give oral ketamine to anybody. We don't prescribe that. It's kind of scary because there are some clinics doing that. There are some online programs that are doing that, which I cannot believe is legal. I can't believe the DEA has not stopped that, because I mean, how many more people is it going to take for that to happen? And then what happens is they just go, oh, yeah, ketamine's not safe, right? This is what Big Pharma wants, but it is safe. And the only reason that nobody is really studying it right now is because it's off label and has been around since the 70s. So there's no money to be made off of IV ketamine. So no big pharma company is going to go, yeah, we want to really do some studies for this.
Wow. There's so many questions going through my head right now, and I'm trying to organize them for us. Uh, I just want to make sure that the difference between what your clinic does is through low doses of intravenous, correct?
We do IV.
And there are other, and I don't want, we're not here about bashing anyone else, but there are other clinics that are doing oral, which is what you talked about, right?
There are some,
And
yeah.
and online you can get that as well. How do you stay, how do I want to say this? How do you emphasize your safety compared to your competitors who are out there saying, well, I've had 500 people do it, and we're doing it this way, and yet you know that it's not safe. I mean, I know you have information out there and pamphlets and stuff, but how can you warn? Let's do it this way. How can you warn a person who's interested in trying ketamine to go to the right place? There we go.
Yeah. So I just think that they need to do their research and find out, like, IV ketamine is really the gold standard. You know, doing it in your home is not a safe way to do it, because you don't know, first of all, you don't know how you're going to react. While it doesn't cause respiratory suppression, it can cause other side effects, right? But you can't, we don't know how someone is going to take that medicine. And like I said, if they're not even doing any drug testing to see or to know if someone is a substance abuser, I mean, we're just very cautious in our clinic, and we want to keep patients safe. That's all I can say is you should also do your research on how long someone's been in the clinic all of a sudden, or had a clinic. Ketamine is kind of the new wave where a lot of people are like, I'm going to go cash in, right? And anyone who's been to our clinic knows that's not how we do it. We care about the patients. And so there are people that are just, brand new practitioners opening ketamine clinics, and they're not following the set protocols. I know because I've seen patient records. We follow everything that ASKP3 is, the governing organization for ketamine providers. We follow their protocols. We go to the meetings. We make sure that we're keeping patients safe. So you just want to make sure that if you're, calling around to ketamine clinics, price and location should not be the number one choices, right? Or number one reason why you choose a clinic. You need to interview them and talk to them about what are they doing to make sure they're safe. Because my fear is that something's going to happen because there are new clinics open up, and I'm going to call them cowboys. I mean, I'm hearing the things that are going on in some of these clinics, and I'm like, it's not safe. And honestly, patients need to understand that complications can happen. And so especially with some things that some of them are adding in, that's what's making it not safe. It's not the ketamine that's not safe. It's what some people are adding in propofol and other things. Propofol does cause respiratory suppression. And if they don't have the equipment to intubate someone, and they don't, I know that, it shouldn't be used in an outpatient setting. So anyway, we, like I said, keep people safe. I want people to interview, like where you're thinking about going, look and see how long the person has been a practitioner. Everyone at our clinic works in the trauma units and the ER units at the hospitals. They have extensive experience being practitioners in a clinical setting, didn't just graduate and all of a sudden decide to open a ketamine clinic, because it's happening. So
That's just like hitting me in such a strange way that it kind
yeah,
of angers me in a way. Also, is that
it
these people
angers me
seem like
too.
all they want to do is make money. And they're making money at the expense of these people who believe that they're coming to that person for help.
Right.
And I guess because I feel like when I walked into your office with all the information sitting right there, it's so transparent, and everyone willing to talk about whatever is in your, I wouldn't say formula, if you want to talk about
Yeah.
that, and how clear it is and clean. And yet you can go online maybe somewhere and maybe find someone who's going to get like half price it, and yet it's filled with other stuff.
Yeah.
And they're not letting you know that
Like
it's filled with
propofol,
anything else.
which is a sedative.
Exactly.
And all it takes, see, this is my concern, John Michael, is that all it takes is one problem, and then the media gets a hold of it because they like to sensationalize things, right? Let's face it.
Right, right,
And
right,
so
right, right.
then it's like, whoa, ketamine's dangerous and ketamine clinics are bad. They aren't looking at the one person that wasn't doing it properly. They weren't using it properly. They weren't using it in a safe manner. And so that's my fear, is that we're going to take away access to patients for this really wonderful treatment and option for them that actually works. I mean, so there's he's a professor of psychiatry and neurobiology at Yale University, and he has said that the rapid response of ketamine, and the treatment for treatment-resistant patients has been the singular most accomplishment that we've seen in treatment for depression in 50 years. So
That's incredible.
so to take that away because someone's not using it properly, that's my fear. So
I just had this idea, question. If somebody's listening to our talk today and they want to get more information, but they're not in the state of Ohio, let's say, can they reach out to you and get more information and ask you? And then maybe you can refer someone in their area that is legit and doing the right thing and not someone who's just out to make money. Because
right.
your office is so passionate about this.
Yeah, we are.
Everyone that works there, from the person at the front desk, and how passionate she was to invite you in. I mean, I was stunned when I walked in and she said, "Hello, how are you today?" And I was like, "Whoa, whoa, what, me?" Because you're not used to it. And it's just
Yeah.
this warm feeling. So please, people, if you're thinking about doing this and you don't, and you have questions, please reach out to Lori. I'm sure she or one of her people, her tribe, will be happy to answer anything. But get the information, do your research. And that's what Lori's saying over and over and over again. Do your research. And I want to know where you want to be in 5 years.
Well, I would like to, so we started adding vitamin infusions and things that also help with mental health. So I would like to have therapy added into, our clinic as we have more things that are other psychedelics that are coming out. I would love to be a part of that journey for people. So they're studying psilocybin and MDMA, which is ecstasy. Um, Right now, ecstasy did not get approved by the FDA because of they wanted a few more clinical trials, but it also is very beneficial. So I would like to have the whole gamut of options for people. Right now, IV ketamine would be less expensive than the MDMA or the psilocybin because the effects of those drugs last longer, and you have to have a male and a female therapist in there. So at this point, that's more expensive. But for someone who maybe didn't respond to the ketamine, that's a nice alternative. I would also like to add stellate ganglion block to our clinic, which is very beneficial for PTSD and also pain. That's the other thing is ketamine is beneficial for pain, for complex regional pain syndrome, CRPS, and then fibromyalgia, migraines, all of that. So it's an anti-inflammatory. So I just want people to know too, if they are experiencing that in addition to the PTSD, then it's a really good option for them. But I would just like to see our clinic growing to where I have, more practitioners. We're open more hours and we can help more patients. This is a tremendous treatment that's offered hope to people who had no hope. I mean, I can't tell you how many people said, this is my last hope. And it worked. So anyway, it feels really good to be a part of that journey with people. So
That's amazing. That's just incredible. And what you're offering people is, again, that hope that they feel like they don't have. And since we're here talking with Zero Abuse Project and survivor space, many survivors feel like they don't have hope and that people don't seem to understand what they've gone through. And yet I feel that when I came in and visited you, that all went out the window. It was like I was welcomed in, I was seen, and I was heard, and I was believed for sharing the stories that I was going through. It's not like I have to prove something to you. It's just I have to be myself. And that in itself could be a big step for a lot of people, even for
absolutely.
myself. And
Mhm.
that's just encouraging because we don't see that a lot, you know. Um, Besides the fact that we tag ourselves as being victims of sexual abuse or something like that, we carry that with us. Sometimes we will change that to a survivor as a word or a thriver, and we keep changing those words, but down deep, we still are that person who went through that experience. And I think again, when it gets back to is the meaning that we placed on it. And what I believe from everything you've said to me today and other times, the ketamine is a answer to remove that meaning so that you could see what it is for what it really was.
Right.
And to help ease the fear of what you're going through at the time. So it's just like, wow, that's amazing. So how can we know that you're in Dayton, Ohio?
Yes.
How can we, as survivors ourselves, help you and promote the new Life Ketamine Clinic in Dayton from wherever we are? What kind of suggestions can we do to help you?
Well, I think just like, my single goal is to let people know that this treatment is available, right? There are too many people suffering and they don't need to, right? So just spread the word that ketamine is an option for people and do your research and just, ketamine can give clarity to people. Ketamine gives hope to people. It really has gotten people in remission. And so, we're here just to help people. So I think just spreading the word as much as you can is great.
That
So
sounds so simple. We can all
it
do
is.
that,
It is.
you know?
That's the biggest challenge is honestly, it was difficult for me after my husband, passed away very early after we opened the clinic. And so me running the clinic, I was just going to do the marketing for the clinic, right? But and I've had a lot of help with my providers and everyone my receptionist, and that have helped a lot. So, but you know, the biggest thing is I haven't been able to get it out and market it as much as I wanted to. So let people know that we're there. So that's the biggest thing. We just need people to know about it, do your research, and then find a good clinic that does it the right way. So
And you're doing that, you're getting it out there and
yeah,
you're sharing, and that's incredible. And I love the passion you have about this and the fact that you're carrying your husband's legacy on with it. And I just want you to know how much I admire you about that and how
thank you.
important that is, because obviously it was important to him and to you to start it, and now you get to carry it with you and carry it with for him and for both of you. And that's really, really a powerful thing.
Yeah.
Um, so I'm just trying to think, is there anything else that you would like to add that we may not have touched on right now? Because this time is going so fast. We have about
I
10
know it
minutes
is.
left.
Yeah. Um, I just want people to understand that, you know, ketamine helps you have a better quality of life, right? We've had people that have been out of work for 2 or 3 years on disability. I wish more businesses knew about this and thought about actually paying for it for their employees, because, you know, one of the biggest reasons people go on disability is because of mental health issues. And so if these businesses knew they could keep people working. So, but I mean, you know, a perfect example, I had a pharmacist. Do you think pharmacists make good money? I mean, this patient was on disability for 2 years and she's back to work, and she finished up like 2 years ago and has had maybe 2 boosters since then. So anyway, I do want to talk about boosters. So, you know, we do a series of 6 infusions, and then some patients need boosters, but not all patients need boosters. So 70% of our patients have not needed any boosters in the time after they finish their initial series. We send out monthly depression and anxiety surveys and have them take them, and you know, they're doing great. We even do wellness checks and people are doing well. So that's another way to determine whether a clinic is a legit clinic or not. There are some clinics that are saying, oh yeah, you need to come back monthly for a booster. Well, only 30% of our patients have needed boosters, and we've been open for a long time. So anyway, so
Wow.
just keep that in mind. But yeah, so it's really about quality of life. You know, we've had people that couldn't get out of bed, and now they're getting out of bed and spending time with their family and going to their kids' activities. So, you know, this facilitates you having a normal life. But once again, you need to put the work in and not just sit back and think ketamine is going to be solve all of your problems, but you need to work through them with your therapist. So
Just want to make sure I reiterate if something if I heard that you said that it does help inflammation, right?
it does.
And I think that's something else that people don't take into account of what this incredible miracle drug is doing. And a lot of us as survivors, we are filled with inflammation because you know, we harbor our feelings deep down and we don't talk about them, and we just keep pushing it down and pushing it down. It has to come out some way. And there are studies that say, you know, negative self-talk and stuff like that can cause diseases, especially in the stomach area and stuff like that, which is based on inflammation. And if this is able to help that, you're not only helping them in the mind, you're also helping them in their body as well.
Yeah.
Wow.
And we do talk to the patients about like eating healthy, you know, eating healthy foods. You know, our body, our brain gut health is, you know, it's has so much correlation there. So you definitely want to make sure that, you know, you're looking at the whole person, not just the mental health, because it all goes hand in hand, right? And so what we feed our body, the less processed food, once again, the FDA, you know, they allow things in our food here that it's not allowed in other countries. But
You're absolutely right.
that's a whole nother podcast. So anyway,
Totally. Also in makeup and skincare, there's so
yeah,
many things.
yeah.
But
So
parabens are still rampant. But also, I just want to go back again also about the boosters, because I think we need to just describe what a booster is. So if I've had my 6 sessions and I've gone away and I'm you know, I'm doing really well for like 3 months,
mhm.
and then something comes up that causes me to slip back down or something, that's when I would reach out to get a booster. Is that correct?
Correct. Yeah. So the average number of boosters patients need in a year is 1 to 2.
Okay.
I do have a few patients. We have a few patients at the clinic that have had more. I mean, we have some that come about every 6 weeks for a booster, but that's rare. I mean, I think there are probably 5 patients that come that frequently for a booster, if that. We've treated over 400 patients. So
Right.
that's not normal, but and it doesn't mean there's anything wrong with them. Everybody's brain is different, right? We don't know how someone's going to react to this. We don't know how long it's going to hold them. But what I have found is people that initially came for more frequent boosters tend to be able to space them out longer after they've had a certain number of them, right? I think they get to a point where, the time, and maybe part of it is the work they've done with their therapy makes it so they can learn how to mitigate those stressors that cause them to have their anxiety or depression back, right?
Right. And there's one thing we have not talked about. Is this addictive?
So, it is a scheduled drug. It's a Schedule 3 drug, but it is very low in the addiction potential. I can tell you that to my knowledge, we have not had any patients that have become addicted to this. We have not had any patients that have, it's not physically or psychologically addicting, but some people just instead of dealing with their stress, may want to come in and get an infusion. And we've worked with
Mm.
those patients and said, hey, we need to not be running for an infusion every time something comes up that's adding you stress. We want you to work with your therapist. So we're really good about not perpetuating that.
Great. Great. And the last thing I want to know is I want you to share your experience of using ketamine. We talked about other people, but what about yourself? Can you share a little bit about what you went through and how it felt to you so that we can get in a first person account?
Yeah, sure. So, I had pretty crippling anxiety after I lost my husband. And I couldn't think. I had no mental clarity. I could barely get through my days. If you talked to me, you wouldn't know that, but my head was running nonstop. Like I couldn't, I got to where sometimes I couldn't even put my thoughts together. And I certainly couldn't focus on everything that I needed to, and then deal with the grieving that I was dealing with. So, um, my medical director's like, I think you're a perfect candidate, Lori. So I did. And it was a beautiful experience. So, my first one, I was listening to this calming music and nature sounds, and I was actually like having a memory. It was a flashback of my husband and I when we were on a vacation, and we were riding horseback like along the coast in Hawaii, and went out into the rainforest with some friends. And so it was such a beautiful experience. You know, I I'm blessed because I haven't had the kind of trauma that so many people have. So for me, my experience has been just beautiful. But like I said, the people that don't have a beautiful experience, or what they're going to have more emotionally neutral way to view it. But for me, I was just in heaven. And so it helps give you clarity. Um, Ketamine helps you form thoughts and gives you mental clarity. And it's interesting because a lot of younger people have come in and had it, and they they talk about they feel like they have their purpose in life. And I too, when I came out of my infusion, all I could think of was love. Like I just want to spread love and joy, and that's what a lot of people say. Sometimes, and this is totally not medical advice, but I really feel like the world would be a better place if everybody had ketamine infusions. Maybe we shouldn't say that, but I'm just saying that it is amazing how people respond after they've had the treatment to other people. They're more giving, more kind, have a purpose, and so many young people experience anxiety because they don't know what they want to do with their life. And so the ketamine infusions for a lot of these people that have experienced severe anxiety, we get a lot of college kids that come in, and it's been amazing and helped them focus to be able to get through their exams and everything. So yeah, it's amazing.
So this is incredible. And so everybody listening, do us a favor, start talking about ketamine
Yeah.
and just get it out there. Start seeing where we can take this all. Lori, this has been so insightful. Every time I speak with you, I learn something new and something different. And that's just so amazing. And you're so full of information. And the thing that I love most about you is the passion and the caring you have about helping people and servicing people to get better. And I just want everyone to see that. And I just want to thank you for taking the time out and spending this hour with us and sharing us about ketamine.
Thank you so much for having me on to get the word out about ketamine. So I appreciate it. And I love the work that you're doing too, John Michael. So
Oh, thank you.
um, I, I think it's wonderful. So we all need to work together to help people get hope and their life back, right?
Completely agree. And with that, that's a perfect segment to say thank you all for joining us today and have a wonderful week.
Thank you.